Today we have the opportunity to spend some time with Dr. Rudolf Loewenstein. And what we'll be interested in doing is to get an idea of your life and your career in a perspective, which is now extended over many years and with unusual contributions. Perhaps we could start by asking you, where did this begin?
Yeah, it began during the First World War in Switzerland. I was then studying engineering in Zurich.
Engineering?
Yeah, but I was always interested in scientific things, but so I was there in that, what corresponds in Switzerland, corresponds to the MIT, it's the Federal Institute of Technology in Zurich, which is a very famous school. But I got terribly disappointed, as you will understand immediately. I was always torn between the scientific knowledge and the literal attraction to literature, reading novels, reading authors, and interested in history and anthropology. And I say it is literal. It's not really that, but more man interested. Humanities, let's put it that way. Psychology, philosophy, and such. On one hand, science on the other. And I apparently was in conflict, which I was unable to resolve in these terms. And a friend of mine at that time, who was a musician, a pianist, who couldn't work anymore. He was unable to practice. Once he talked to me and said that he's now much better. He can practice since his neurosis is cured. And I had no idea. I vaguely heard about Freud and psychoanalysis, but it was interesting, but it never kind of was decisive until this friend described to me what his anxiety was. Whenever he sat at his piano to practice, he had the impression at night when it was that the white figure would come with a lit candle would approach him and make a gesture to turn his music over the page, He was so panicked by this image or by this idea that he had saw this lady, that he was unable to practice. And he met a lay analyst by chance who said that he might analyze him. At the time, and it was done in a way in which Freud may have done some kind of peculiar forms of psychoanalytic technique by walking with the patient. The analyst walked with him and talked with him, and the patient described to him what the symptom was, and then they analyzed a few of his dreams. And this friend of mine got cured, apparently, at least at the time when he
felt much better.
Much better. Could work again. And I asked him, now, what is it? He said, because he explained to me what this lady meant to me, what it was. He said it was my mother who would come at night to help me, like would come to tuck me in, at night. He was alone in Switzerland. His family was far away, and they couldn't get in touch with them. It was the second part of the world, it was the First World War. He couldn't communicate with his family who lived in Russia at that time. He was penniless, and this need to have a protective mother was expressed in this form of neurosis. I was terribly impressed. I was so impressed that I said that that's something I will have to become. Or at least first I said that I have to read Freud. And then I did indeed read a great deal, which was made possible by the fact that I knew a couple who were both analysts in Zurich, Dr. and Mrs. Oberholzer. And they had naturally the whole Freud, and I read a great deal. And I read also this little introduction or kind of foundations of in a book written by this lay analyst, whose name was Leon Kaplan. And it impressed me enormously, so that it was, can only say, a kind of love at first sight, which never disappeared. It remains still there, you know. It was a synthesis of scientific approach and the humanities to me, and that is, I'm sure, that is what made it so extremely attractive to me and extremely fascinating and interesting. There were such fantastic discoveries which seemed to me immediately correct, and others which seemed to me quite problematic, and I decided to learn and to know more about it and to become an analyst.
Now, this interest preceded your going into medicine.
Yes, I preceded. That's why I went into medicine in order to become a psychoanalyst.
I see.
So I started my medicine then in Zurich, but had to leave. My father died then in Russia, and I had to go back, but didn't want to go back. So I remained in where I could learn analysis. First of all, I wanted to go and live and work in Paris. I didn't like either Russia or certainly not during the takeover by the communists at the time. Neither was I interested. I stayed in Berlin just because I wanted to learn to be an analyst and then go to France. That was my plan already at that time.
So that you went on in medicine, then it was interrupted by...
No, I finished my medicine in Berlin.
In Berlin?
In Berlin.
And then when did you begin your formal...
At the same time, you see, at that time things were not that formal yet. I could study analysis at the institute there, at the first institute that ever...
Along with your medical
Along with
education.
my medical studies.
I see. I see.
I could do more psychiatry and neurology than it would have been necessary.
Now, what was the state of the institute at that particular... Berlin was the first institute?
The first regular institute with a kind of regular curriculum and expectation of a training analysis that was already introduced as a requirement.
A requirement there.
Yes. And discussion groups, not panels, but some kind of supervision, certainly. With the first clinic cases, they had a clinic, this institute. That means outpatient kind of clinic for analysis of patients who had no money.
So that it would provide the basis of current day institutes.
Right.
With the difference that this could be done simultaneous with your other medical education.
Yes. The psychoanalytic lectures were in the evenings.
I see.
Lectures and reading and the meetings. And in some way I could combine the hours between.
Yeah. Now, who would stand out in your mind as those who were important to you as teachers?
First of all, Karl Abraham. He was not my teacher in as much as my analyst was Hans Sachs, whom I highly think of still as an analyst. And that these two men were outstanding, Abraham and Sachs. Then there was Max Eitingon, who was a very devoted analyst, but as a teacher, I thought of him less. Mm-hmm. You know, And to begin with, there was already Dr. Horney was there as an analyst.
She was there.
She was there, yeah, but she didn't play a role as a teacher or a thinker at all. At least not in my mind.
When did she come to this country?
I don't know. I think
I
think in the 30s.
I see.
I don't really know. It must have been at that time.
Now, did you proceed with it? That is, when you finished your training in Berlin?
I continued working there, seeing patients, and Abraham was very nice and wanted me to stay and play a role in the life of the society there and so on.
So you stayed there how long?
Another year and a half.
I see. Which would take you to what? To 25,
yes. And it's then that I went to Paris and thanks to Marie Bonaparte, I was permitted to go to Paris and to register in the medical school and in Paris, medical faculty as it's called.
I see.
And they were very helpful in as much as the studies there are 6 years, and I required of me only the last 2 years, the clinical subjects, not the theoretical, which they accepted as without my passing exams on it.
All right. This was in order to practice
In France, yeah. But first of all, I had to go through and have a bachelor. That means what is, here, the ending of the secondary schools. That means a baccalaureate in France. Mm-hmm. And that means all the subjects of, let's say, a high school with, in addition, what is the first 2 years in a college about the program. Mm-hmm. And I passed naturally this baccalaureate and then passed my medical exam in Paris, was permitted to practice.
No. And then you practiced in Paris?
Yeah. But I started practicing actually mostly, not really with patients, but only those patients who were sent to me, my French doctors, because I didn't have a right officially to practice. But under these conditions, it was perfectly legal. Mm-hmm. They were very, very...
Now, you mentioned Marie Bonaparte.
Whom I met only in Paris when I got there in 26. She was then already in analysis with Freud. And when I came to Paris, she was still in Vienna. She actually divided her time in 6 months in Vienna and 6 months in Paris. Yeah. The children were already adolescents, and father was there.
And this was a relationship then that extended over a long period of time.
Oh yes, oh yes.
Because one of the things that stands out in my memory is her efforts on behalf of Freud in terms of
yes,
his getting out of Vienna.
She was extremely devoted to him, and he has done enormously for her, by analyzing her.
Now, how many analysts were there in Paris at this time?
When I got there, there were 2 more analysts. The first one was a lay analyst, a woman, Mrs. Sokolnitska, Madame Sokolnitska, who had some training in Vienna.
I see.
Who came to Paris to become an analyst, to practice as an analyst in 23. And one of her analysans was the one who most actively immediately started analyzing. That was René Laforgue, who died recently, a number of years ago, in Paris. And that was that, actually. There was still another one, but he didn't. Alain D, he had comparatively little training, and he was not a training analyst. Although he did continue in analyzing people in his very special, particular way. Yeah.
And now, how did the field grow at that particular time? I mean.
There were a number of psychiatrists who were interested in analysis, but there were considerable difficulties for them to learn it. First of all, the training analysis was difficult to have because they didn't. Laforgue was their colleague, and they didn't want to go in analysis.
Mm-hmm. Because of his opposition?
Not opposition, no. They had obviously personal reasons. They knew him personally, maybe not like him, and didn't want to be in analysis with him.
Oh, I see.
There's one other one, a very brilliant man, Pichon, was analyzed by Madame Sokolnitska. But I was aside from that, I was the first training analyst there, although so young and so inexperienced. The man whom I first analyzed was Parcells, who died since, who was an internist. He was one of the rare who were not psychiatrists. He was internist. And then came other who now are very well known and who are still alive. One is Daniel Lagache, and who is now professor of psychology at the Sorbonne, clinical psychology, which requires that one is psychologist and psychiatrist both. That's the requirements of the Sorbonne. And who played a great role. It's a brilliant man. He's ill now, but a brilliant man. And the other one was Sacha Nasht, who was also at the same age as Lagache, but was a psychiatrist. So gradually there was a more and more number of analysts, most of them older than I in age.
And when was the society as such formed?
Formed in 26.
In 26. Upon your arrival?
Practically, but it was done actually not by me, but by Marie Bonaparte.
I see.
She insisted and she transmitted Freud's opinion that one should not be satisfied with a kind of psychiatric society which was there, and they were interested in analysis, but moreover were also completely hostile to analysis.
All right. Now, at this point, then, you would have been relatively isolated.
No, yeah, I was isolated. On the other hand, I was also I had good relations with a number of those colleagues who started
developing their interest.
Right. And it was inevitable. One obviously had to have relations with one's analysants who are not optimal.
Yeah.
But it was inevitable there where one may meet all the time. Exactly. And know socially, and it was difficult not to meet and not to know them personally.
Now, this would have then made the international meetings or the times when you could get together with other people from other parts of the country. Did others come to France who were not trained there?
If one or two, no, all of them had been trained elsewhere.
I see.
Yeah. But in the course of things, more French psychiatrists and doctors who became very interested and became analysts. Mm-hmm. So that this group, which consisted this founding group, we were, I think, 10 or 11 people. When the war, the Second World War started, there were over 20 analysts. 24, 25.
Now, you came to this country
in 42.
In 42.
Yeah, from southern France. I was, during the war, I was in the French army as a battalion doctor.
I see.
Yeah, in a kind of older group of soldiers, not in the first, not in the soldiers around my age, in the early 40s. You know.
Mm. And now many must have been captured.
Many were captured, but I was fortunate not to be captured at all, and the armistice was signed when I was in the south of France, in the southwest of France, as a matter of fact, in the Dordogne Valley. That's a part of the province in southwest France. So that, and my then wife and 3 of my small children were there in the occupied zone, but I could get them down south, and in the non-occupied region or the preoccupied region. That's what we thought. Yeah. And until I could leave this, it was quite clear that sooner or later the Germans will occupy everything and it will get worse than ever. That was obvious, and I was very grateful to the colleagues in New York who made it possible to become special visas. And I also had very good friends from Paris who were in New York and were very helpful to me to come over.
Now,
you asked me before what my connection with Hartmann and Chris were,
right,
and what it meant to me.
How did they come about?
That we started working. They had started. I didn't know that, but look how I'll describe to you briefly. there was here during the war a kind of group of French teachers of the university or doctors and so on who, thanks to the new School for Social Research, were permitted to teach in French some subjects. It was a little kind of apartment where one would meet. And there I was also asked to speak about psychoanalysis, and among other things, I asked a young lady who worked with René Spitz on child development and who had been a PhD in child development in both from Vienna, from Bühlers, who was a famous psychologist, as well as a student of Piaget in Geneva. And there was a discussion between us, kind of a seminar between the two of us, the difference between Piaget and psychoanalysis, or genetic psychology and the genetic approach in psychoanalysis. The genetic psychology, which is the term for Piaget's psychology. And when we finished, there sat Hartmann and Chris at the table on a bench and congratulated me after these 6 discussion times. And they asked me to join them and work with them. Just that, you see. So I had known them before, known their writings very highly, admired that.
Now, how did you meet them before? And
Personally, and also discussing some papers. For instance, with Hartmann, during the war began already. We found ourselves by chance in the same vacation spot on the beach in Brittany. And I had sent this manuscript, which was then published in the International Journal. Hartmann was the full editor, the editor of the German language international Zeitschrift of psychoanalysis. And he discussed with me this paper and was very helpful in disagreeing with me on some points, and then I formulated it differently, and he accepted this manuscript, and it was published. I read it then in German and in English only 4 years later. Well, 4 years? No, 3 years later. I didn't know it was published. Discovered it here.
Discovered it
here.
When you got
it? Yeah, not immediately. For a long time, I forgot it all.
For heaven's sake.
Yeah. It was published in the journal, International Journal, and the German Journal in 42, I think, the time of my arrival. Right. Only I learned it
but
only
you didn't know about it.
No.
No, all right. So this was your initial
And then we decided that we would work together. Now, I have one reason why I think Hartmann thought that he may want to work with me. He was very nice and very complimentary when he was auditing my course on technique here in New York, the first course I gave. It was very encouraging, and it's very much kind of avant-garde, you know. But then we also often sat at the same paper, but purely clinical. And after leaving this, and as I told you, I am extremely interested in data in analysis. But I made a kind of remark to Hartmann. I said, analysis will be gone in 20 years unless one does a work of what in medicine is called physiology. Not clinic, but physiology. He didn't say anything, but he kind of picked up, and I think that was the reason why he said, come and work with us. There was more reasons. For instance, we agreed upon the role of the autonomous ego, which was his discovery before the war, and his formulation, and that was very, very impressive to me and very correct. So though it must have been somehow a closeness, and with Chris too, with his work. So we decided to meet once a week. And this is how this collaboration started. We would talk about, we decided and saying we're going to think about what can be said about ego psychology or the ego in psychoanalysis. And so we gradually, I felt that they had done so much more before than I, that I was very kind of impressed and was very happy naturally to be able to work with them. I had no reason to be that awed, but I was to begin with.
And it's always a happy kind of circumstance when you find people that you can work with.
Yes, and the work was extremely interesting. It was an enormous kind of intellectual experience for many, many years. You know, we worked practically, I would say, 16 years, I think, altogether.
I think very close.
Yeah, very regularly for 12 or 13 years till Chris died. After his death, it was difficult to resume.
Yeah.
There was almost a kind of, I know in me, a kind of a reaction of mourning, and that I couldn't work with him not being there.
Yeah.
And he also was an extremely brilliant, enthusiastic man, full of new ideas and very fine in formulating certain ideas. In synthesizing. You know, Hartman was actually even more of a synthesizer. Yes. Synthesis with Hartman came differently than Chris's. Chris was much more imaginative in his formulations, and Hartman was more kind of very short, brief, and very concise, without this magnificent imagination that Chris had. You know.
One of the things that I think many have wondered about is the extent to which the clinical data, that is, when you point out you have this basic interest in data. And
in theory too, but not independently of data.
Now, in the writings of Hartman, one sees not so much clinical material.
Right. But in our papers, which we wrote, the three of us, you must sense that this was, every formulation was checked for data. There is not a single word, not a single sentence who had not gone through that. Didn't you sense that? Some people told me that it was quite clear, although we did present clinical material only very rarely. There was always, if there was not a single clinical material, any datum, which we wouldn't write it.
Exactly. It is, would be most important to understand is how three such independent individuals could collaborate as closely as you did, both in terms of the details and the direction of your interests.
Look, we proceeded, we met together, and let me tell you just one anecdote. It happened the second time we met. After the first time we met, the next appointment, next day, it was at Hartman's house. The first one was at Chris's house. And I came to see him. Chris wasn't there yet, and I told Hartman, I feel terribly inferior to that task. I put it differently, but it's meaning. He very kind of dryly said, "You are not the only one." So that was all we said.
Yeah. Well, which really means that you and he and Dr. Chris must have felt that you were involved in an enormous problem.
Yeah. We knew it was a fascinating, very important problem. We started saying about the ego in its development. Became clear after a while, that we thought of the ego in terms of development, and how that its role in the functions later on, how it is to be put together, particularly in view of the variety of concepts or the ideas which were connected with the term ego. You know, the self, the ego in terms of the functions, in terms of connections between the outside world and the function as a defense, and so on. And what we also became aware of, that Freud formulated these things very differently during his life. That at one moment ego was this, and then another this,
without changing
the word. So one of our ideas was also not so much to write the history of the concept of the ego, which Hartmann wrote later on in 56, but how these hypotheses and these formulations and these concepts, how they can be synchronized, so to say. What Freud said here, and here, and this, then afterwards, how can we synchronize these various approaches to the concept of the ego and make something that fits together?
All right, now, you obviously had posed yourself an area within which to direct your...
We talked, all three of us, and we were not obligated to talk necessarily. No program was at all. We could come and say hello and talk a few moments, and then suddenly someone would say, yes, you remember, I am puzzled because I remembered with a patient I had this and this and this. How is that fits with the ego functions, or for instance. And so everybody added something, and then come back and forth, and this formulation, no, but that it wouldn't fit with the other, and another observation.
So it was a matter of bringing in theoretical, what other people had written.
Completely clinical material every time. Every time. It was practically always there. And sometimes repeatedly we follow the idea, but each one wrote down things, and it was amazing how different points we wrote down in our notes.
That is, you would rather take notations as you went along. Points of view.
No, I am not very good in writing notes. Especially I had this one difficulty with them. We didn't know the English language well enough at that time. I certainly didn't. To discuss in English. So they had been used to discuss in German. But I had to translate that into French, but to write it in my notes, because I had practically forgotten the German language. I understood perfectly well, but I couldn't talk about psychoanalysis in German anymore. You know, I had my training in German. But this was not my mother tongue, although it was my parents' mother tongue. But so I had this problem too. When they said something in German, I had to write, and I'm not good at it at all in no language.
Well, now, actually, your discussions as such took place in German.
Yes.
But your notes
I spoke in French, and they both understood me.
They both understood you in French.
Yes.
I see. So when you got...
And sometimes we suddenly veered into English, especially later on. When it became as a very obvious language, we spoke all three, you know.
As your... Now, actually, you're talking about Chris, who came in...
He came here in 41, I think.
41.
And Hartmann in
by about a year.
Right, and Hartmann too.
And Hartmann about that same time.
About that same time, yeah.
And now, originally, Chris had come from England.
From England, but he left Vienna when the Nazis came.
This was back in 38, 37.
38.
And the same would have been true of Dr. Hartmann.
He came in 38, but to Paris, not to London, and not to America yet.
I see.
He came to Paris and worked there.
Until such time as he came here.
Then the war started, and we were caught both there in Brittany that summer, when the war started, and he went back to Switzerland. You see, his grandfather was a very important political figure of the democratic youth in Germany, or in Austria for that matter, in 1948, the famous Revolution 48. And he was condemned to death by the monarchy, by the emperor of Austria-Hungary. And he was saved by his friends by putting him in a casket. And he was that way taken out.
That's how he got out?
Got out of Austria, yeah. And went to Paris, and he was a famous writer and poet, wrote Hartmann's grandfather. Then went to Geneva and lived there, and there got married and to a Swiss lady, and became a Swiss citizen. And once a man is a Swiss citizen, all his children forever Swiss. So that Hartmann was able to go to Switzerland, where he worked and stayed, I think, for a year and a half, if I'm not mistaken. And then he came to the United States.
All right. Now, I touched on this earlier, but another aspect of the role that each of you must have played in the other one's life was consummated in your scientific productions. Now, how did you work out the final arrangements? Did you feel that you so understood each other that each of you could have essentially written the paper?
No, I don't think so. Or going through the notes of each one, if I could have seen that, maybe. But the final thing of how to put it in from a literary point of view, how to
express
compose it, how to the composition of the paper.
Right.
I think the one who did it by far better than the other two was Chris. He had a
grasp of expression and of the language.
Right, yeah, by far.
And then the other two of you would...
Oh, we corrected it. We used one paper we had to correct completely. I mean, there was a paper he apparently was somewhat ambivalent about or didn't like it the way he... So, which changed it very much. Each one
and thrash it out?
Yes, and said, no, this you cannot say this and this, and so on. You know, we were completely without any inhibitions in this respect. Yes. We knew we respected each other, and that was
it. And that you could speak
freely.
Completely free.
Yeah.
Now, when you say that you would get together once a week, this would be in addition to your teaching responsibilities and many other responsibilities?
Right, and seeing meetings, you know, and such things, meetings and committees and well, God knows what.
And yet you continued through all these other...
Yes, and we each one wrote also personal papers during that
exactly.
time. Yeah.
Now, how did your, I'm aware that all three of your wives were in analysis, in the field of analysis as well, and must have been very supportive of your interests. And
very much so, although at times we both had, all of us had the feeling that we don't give enough time to the children.
To your families.
To the children. It was put that way, by the wife of one of the three of us.
Exactly. The demands would be enormous.
Enormous. But look, we were young at that time still, and having a very considerable ability to work till late at night, and not without, you know, working all day long and in the evening and weekends and such things.
Now, in the papers that you wrote, apart from a collaborative kind of thing, did you also bring these together for mutual discussion? I would presume you did.
That we did what?
That you would, I mean, even though you didn't co-author papers, you would still share these ideas.
Yes, and show to each other. And for instance, by then I wrote this book on Christian and Jews. I don't know whether you ever read it.
Yeah.
I also showed it to them. We somehow discussed these kind of problems.
I mean, these would have been ideas that you had.
It was all right, my idea. I had read all the literature and so on, but it was still, I would show and say, what do you think? Is that right? And so on. With that kind of.
Now, there's another facet of your career which I think ought to be, spoken of, both in terms of your teaching at the Institute and your role at the Institute, and your role in terms of the American and the direction in which analysis is taken, not only from a theoretical point of view, but from a leadership standpoint, which again has had to have taken, a great deal of your interest and direction. Have you felt that, if one simply speaks of all of the time that you spent in conferences and solving problems and this sort of thing, do you feel that this detracted from your scientific interest, or was it something?
Not interest, no. I was not interest for my time. Yes, obviously it detracted. There's no question about it. But I was never a good administrator, and never a good, not really interested in, let's say, in committee work.
In committee work as such.
No. I had to do it because I was president of the Institute, of the New York Institute long ago, then a society, and then the president of the American, which took me enormous amount of time. It takes so much time, very much time.
Which I think one of the remarkable things about the American is that they have, not invariably, but they've very often taken some of their most outstanding analysts from a scientific standpoint and from a teaching standpoint, and have had them as president of the American or in these kinds of top positions.
Yeah.
Which, of course, as you say, may not be your favorite thing to do.
No, certainly not.
Now, with the Institute, you began with the Institute shortly after you arrived.
Well, as soon as I arrived, and as soon as I had my permission to practice, the state boards.
The state boards.
Yeah, and that happened in the beginning of 43. I came here in spring of 42. Passed all the exams in September except one which I passed again in January. From that moment on, I became a training analyst.
Training analyst and
could practice.
All right. Now, your courses at the Institute.
My first course was before I was a training analyst in the extension school. The questions of values and psychology and so on. My first real course, teaching course here at the Institute was on the technique course, which had never been given before. I don't know why.
And has always been a central interest of yours.
Yeah, I was interested. I think it's not so much alone the therapeutic technique, but rather what I told you privately a moment ago before we were here on heard and seen, that I wanted to see the data on which certain theories were built. And I thought so that actually when I say technique, I mean actually methodology.
Methodology.
It is much more correct. I never called it that way because the term was usually technique, and it was understood to be a methodology, and that interested me particularly.
And has apparently from the inception of your interest in analysis, in a sense.
Quite early, yes. Quite early. The first paper I wrote on technique was, I think, in 1927. Well, that was not it was a kind of paper to condense something for a publication. A more particular paper was Untact in 1930 in French. I first wrote in French because I thought my function is to teach my colleagues. Yeah.
Now, you've spoken of your earlier interest in literature, and that actually your ability to synthesize or coordinate your interest in science and in literature.
Yes, my first paper which I ever wrote was in 1923. I wrote it in German, of all young languages. And that was on a novel by a French, rather Belgian author, which is called Arbour, that means all head down, And it was on black masses. And I wrote a paper on that, So the novel, not a clinical case, because I didn't have any experience.
At that point.
I think I wrote it, 23 it appeared, so I must have written in 22 or so.
Now,
or maybe the same year.
If, this is a perfectly absurd kind of question, but I mean, it does sound as though, had analysis not presented this opportunity, you would have moved in the direction of the humanities.
I'm not sure.
You're not sure?
I'm not sure. Better not
Postulate on
to
that
speculate on that. I would not have been as happy as I would have been.
As you have been in
This is a great thing in life, to have a profession that one always is interested in. And is really something which is always gratifying. And I'm very, very grateful for that. I see many people, patients, who have a profession whom they don't like, It's a great difficulty in life.
Is there anything, we're going to have to stop before very long, from your overview of the situation, where do you see the, if not the practice of analysis, the field of analysis? In what directions do you see it moving at this point? That's really an unfair question, and I appreciate it. Obviously, you've seen it move from its beginning in the interest in the instinctual drive, then brought to it the facet that you shared and promote the ego.
Yeah, but that was a general trend. It was not only mine. It was Freud's trend too.
As well.
Yeah, from 1923 on. And it was quite clear how he was interested in that aspect, as well as in the superego. I heard him the last time he spoke in public at the Congress, and there he introduced the concept of the ego, the id, and the superego. And it was a magnificent speech.
You say the last time that he spoke in public?
Just before he got his cancer of the jaw. It was in 22. 22 in the Congress in Berlin.
And from that time onward, he gave no...
He never public speech. He once spoke still after that. I think at some kind of Viennese meeting, at a group, Viennese group, but he never repeated it anymore. His speech was very difficult.
And actually, those who knew him he would have had his conversations and this sort of thing. But,
yes, that he could do. But he had very often terrible pain, or constant, actually. And he never complained, never spoke of it, he never took anything but an aspirin against it. All these 16 years he had it, with over 30 operations, surgical interventions.
One sort or another. Well, again, it's somewhat unfair, but again, I would wonder what, from your purview, what directions do you see our field going?
It is going, whether I like it or not. It is that analysis becomes more and more important to prepare, to make it possible to have analytically oriented psychotherapy. It's not that what I would like,
Yes, I understand.
but this is the movement.
I see.
And after all, this is understandable. There are people for whom analysis is impossible because they don't have enough funds, and analysis lasts very long, so that it is. But naturally, it does not take care of certain character disorders, which only, if it can be at all done, analysis is probably the only treatment of choice.
And of course, this would in turn threaten the database.
Right. Yeah. Except those people who, if they want to hear, to want to listen and to observe, they could find enough data. But still, it's not the same clear way of getting these data.
At the material upon which the advances.
Because the technique is not only there to treat, but technique is there to clarify what is happening in the patient, or what had happened to him. And this leads to a therapeutic effect, is to being able to observe. Our technique is to permit the patient for us to see things, to hear, if you will.
Now, at the time when you were entering in analysis, there was no such thing as child analysis.
No, it began about that time in the 20s.
In the 20s?
Yeah, in the 20s.
Largely.
I remember in the Berlin Society, Melanie Klein was then a trainee. She was trained by Abraham.
By Abraham. This was during a time when you were still there?
Yes. In the late. Wait a moment. It was before I left. That means 23.
Yeah, 24.
22, 23. Because she left then in 24. I think she left for London.
I see.
And then soon after that, it was Anna Freud who. But I remember Melanie Klein speaking of play technique. But she was not the only one to introduce it. I think Anna Freud did it too. But her name has to be connected with that technique, which is her theories and her theoretical explanations of what she observed, that's another story. There I didn't have very much confidence in her work. But that's neither here nor there.
Neither here nor there. The point being, however, that as you try to develop a genetic concept of the ego, obviously it becomes a critical matter through child observation and through the contributions of because here again is another source of data, I would presume.
And there precisely, I will say that, because though it's a kind of nasty remark about her work, but it impressed me so much, unfavorably, how frequently she would come to the meetings of the Berlin Institute and someone present the paper and she would say, strange, yesterday I observed this and this and this, and the next week or next month she would again have observed such a thing. So I felt that she had a lack of critical sense.
Certain improvisational quality about this matter. Of course, I don't know how it's something that our science has to work out over a lot of controversies and so forth, but in due time, I would presume that those most practical and valuable basis of understanding will persist, regardless of personalities or
certainly.
Schools of thought.
Yes. Analysis is here to stay. There's no question.
And is on a very different base than at the time when you first developed an interest in the field. Well, I understand that this in no way really covers the extent of your interests, your contributions. We find ourselves limited by time.
Yes,
I'd
I
really like
understand.
to thank you for
You're very
most
welcome.
interesting time
Good.
together.
Thank you.
Okay.